A risk for progression of HIV/AIDS is more if CD4 cell count is less than 200 per unit liter. A risk for progression of HIV/AIDS is more if CD4 cell count is less than 200 per unit liter. Asynchronous cardiovasculation is given in ventricular fibrillation. Asynchronous cardiovasculation is given in ventricular fibrillation. Therapeutic position given after infratentorial surgery is flat position. Therapeutic position given after infratentorial surgery is flat position. Myopia is dash nearsightedness. Myopia is dash nearsightedness. Hyponatremia means dash decreased sodium levels. Hyponatremia means dash decreased sodium levels. Which monitoring is most significant after a contrast based procedure? Urine output. Which monitoring is most significant after a contrast based procedure? Urine output. Fracture of the distal radius is called Colles fracture. Fracture of the distal radius is called Colles fracture. Never fever, headache, knuckle rigidity are classical symptoms seen in meningitis. Fever, headache, and knuckle rigidity are classical symptoms seen in meningitis. Fever, headache, and knuckle rigidity are classical symptoms seen in meningitis. Drug of choice for patient with heart failure to improve cardiac output. Digoxin. Drug of choice for patient with heart failure to improve cardiac output. Digoxin. Pyroxidine is given along with which group of anti-tubercular drug? Isoniazid. Pyroxidine is given along with which group of anti-tubercular drug? Isoniazid. The cause of pruritus in CKD patients. Uremia. The cause of pruritus in CKD patients. Uremia. Moon phase, hirsutism, and truncal obesity are characteristics of Cushing syndrome. Moon phase, hirsutism, and truncal obesity are characteristics of Cushing syndrome. A drug is to be delivered by nebulizer. The size of a droplet for its humidification is dash less than 2.5 mm. A drug is to be delivered by nebulizer. The size of a droplet for its humidification is less than 2.5 mm. The common treatment option which is used to treat psoriasis. Photochemotherapy. The common treatment option which is used to treat psoriasis. Photochemotherapy. Parameters increase as myocardial oxygen consumption increases dash are preload, afterload, contractility, and heart rate. Parameters increase as myocardial oxygen consumption increases R dash preload, afterload, contractility, and heart rate. Accumulation of purulent material in the pleural space is called dash emphysema. Accumulation of purulent material in the pleural space is called dash emphysema. A nurse is taking blood sample for ABO analysis. What is the common test prior to do before taking sample? Allen's test. A nurse is taking blood sample for ABO analysis. What is the common test prior to do before taking the blood sample? Allen's test. A nurse is taking blood sample for ABO analysis. What is the common test prior to do before taking the sample? Allen's test. A nurse is taking blood sample for a ABO analysis. What is the common test prior to do before taking the sample? Allen's test. Post-operatively, after the initiation of feed following esophagectomy, the client develops increasing pain, fever, and dyspnea. These are suggestive of anastomosis of leakage into mediastinum. Postoperatively, after the initiation of feed following esophagectomy, client develops increasing pain, fever, and dyspnea. These are suggestive of anastomosis leakage into mediastinum. Postoperatively, after the initiation of feed following esophagectomy, client develops increasing pain, fever, and dyspnea. These are suggestive of anastomosis leakage into mediastinum. First indicator of graft occlusion after revascularization. Sharp increase in pain. First indicator of graft occlusion after revascularization. Sharp increase in pain. What is the first line management of epistaxis? Pinch and move forward. What is the first line management of epistaxis? Pinch the nose and move forward. Pinch the nose and move forward. What is the first line management of epistaxis? Pinch the nose and move forward. Clinical sign in which pressure on the left lower quadrant of the abdomen causes pain in the right lower quadrant is known as rousing sign. Clinical sign in which pressure on the left lower quadrant of the abdomen causes pain in the right lower quadrant is known as rousing sign. Mechanism of action of K-axillate enema is dash. Exchange sodium for potassium ions on the colon. Mechanism of action of K-axillate enema is dash. Exchange sodium for potassium ions on the colon. Dash is a small central pit composed closely packed cones in the eye. It is located in the center of the macula lutea of the retina. Foveae centralis. Dash is a small central pit composed of closely packed cones in the eye. It is located in the center of the macula lutea of the retina. Foveae centralis. Main nursing intervention to a client with Alzheimer's disease is dash. Maintain patient safety. Main nursing intervention to a client with Alzheimer's disease is dash. Maintain patient safety. Commonest cause of pulmonary embolism is dash. Thrombosis in deep veins of the leg. Commonest cause of pulmonary embolism is dash. Thrombosis in deep veins of the leg. Hydronephrosis occurs due to dash. Obstruction in urine flow. Hydronephrosis occurs due to dash. Obstruction in urine flow. Thanks for watching. PSC Nurseന്റെ വീഡിയോകൾ ഇഷ്ടപ്പെടുന്നവർ ഈ ചാനൽ ലൈക്ക് ചെയ്യുകയും നിങ്ങളുടെ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുകയും ചെയ്യുക. വീഡിയോ കാണുന്നവർ ഈ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുകയും ഫ്രണ്ട്സിന് ഷെയർ ചെയ്യുകയും ചെയ്യുക. ധാരാളം വീഡിയോസ് PSC Nurse എന്ന ഈ ചാനൽ ഉൾപ്പെടുത്തിയിരിക്കുന്നു. വീഡിയോസ് റിപ്പീറ്റ് ചെയ്ത് കാണാൻ ശ്രമിക്കുക. അത് നിങ്ങളുടെ ഓർമ്മയെ കൂടുതൽ ശക്തിപ്പെടുത്തും. നന്നായി പഠിക്കുന്ന എല്ലാവർക്കും ഞങ്ങൾ വിജയാശംസകൾ നേരുന്നു. നന്ദി, നമസ്കാരം.